Hello, today we are going to be taping NUR Revised 365 IV Insertion and Discontinuation Formal Competency. And today Sarah Enriquez is going to serve as our student nurse. So she will begin by verifying the healthcare provider's orders.
I verified that there's an order for an IV start. We'll be administering 0.9 sodium chloride at 100 mLs per hour. Sodium chloride is an isotonic solution we're giving for dehydration today.
Review the patient allergies.
The patient is allergic to morphine and bananas, which will not affect our procedure today.
And now gather the necessary supplies. Sarah will find the appropriate IV catheter. Two by 2 gauze, a transparent dressing or tegaderm, an extension set or INT, alcohol swabs or CHG pad for cleansing, a tourniquet, a Chuck's pad,
The tourniquet is on the patient.
2.5 ml 0.9% sodium chloride flush, and a swab cap. She will also have her primary solution and primary tubing. Okay, introduce herself to the patient and family if necessary, and state name and credentials.
Hi, I'm Sarah. I'm going to be your student nurse today. I'll be putting in an IV catheter. There's no family present.
Perform hand hygiene, and provide patient privacy.
I'm going to pull your curtain for privacy.
Identify the patient using 2 patient identifiers such as patient name, date of birth, medical record number, and compare to the patient's MAR.
Can you tell me your name and date of birth? Good.
Scan the patient. Again, verify patient allergies.
Can you tell me if you have any allergies? Okay, that won't affect our procedure today.
Sarah will select and scan the correct IV solution in normal saline flush.
Checking for color and clarity. Expiration date.
She will now perform the first check of the 5 rights of medication administration of both the IV solution and the normal saline flush, comparing it to the MAR, checking for patient, medication, dose, route, and time.
I have IV practice, date of birth 3/3/87. 0.9 sodium chloride, continuous infusion, 100 mLs per hour. I have 0.9 sodium chloride IV fluid. IV practice, date of birth 3/3/87. 3 to 10 mLs, 0.9 sodium chloride flush, IV, PRN. I have 0.9 sodium chloride flush.
Now open the flush and purge the air from the syringe. Adjust to the 2.5 ml dose. She will now perform the second check of the 5 rights of medication administration of both the IV solution and the normal saline flush, comparing to the MAR.
I have IV practice, date of birth 3/3/87. 0.9 sodium chloride, 100 mLs per hour, IV. I have 0.9 sodium chloride IV fluid. IV practice, date of birth 3/3/87. 3 to 10 mLs, 0.9 sodium chloride IV PRN flush. I have 0.9 sodium chloride flush.
She will now perform the third check of the 5 rights of medication administration of both the IV solution and the normal saline flush, comparing to the MAR.
I have IV practice, date of birth 3/3/87. 0.9 sodium chloride, 100 mLs per hour IV infusion. I have 0.9 sodium chloride IV fluid. IV practice, date of birth 3/3/87. 0.9 sodium chloride, 3 to 10 mLs IV PRN flush, and I have 0.9 sodium chloride flush.
Okay, now she's going to prepare the bag, and she would say, I would spike the bag and prime the tubing and place the tubing in the IV infusion pump.
I have a Laris IV infusion tubing. I'm going to close my roller clamp. And aseptically spike my bag. Squeeze the chamber and prime the tubing. Making sure that all air has been expelled from the tubing. And then again closing my roller clamp. I'm going to insert the tubing into the pump and hang the IV for use when I'm ready.
Okay. Explain to the patient the reason for the infusion, the solution ordered, the procedure initiating the IV, and signs and symptoms of complications.
So Ivy, today I'm going to be putting an IV catheter in your arm. Have you had an IV catheter before? Good. So I'm going to insert a needle and a catheter into your arm, then the needle will be withdrawn and the catheter will remain in place. We're going to hook up your IV fluids. You're going to get 0.9 sodium chloride for your dehydration, and we're going to administer that continuously. We're going to watch your site and ask that you watch the IV site also to make sure that there's no swelling or redness as the IV infuses. If you get up out of bed and move around at all, we ask that you call the nurse so that we can be careful that your tubing doesn't get snagged, you don't trip over anything, etc.
Raise the bed to a comfortable working height and help the patient to a comfortable position. Also provide adequate lighting.
Okay, I've raised the bed to a comfortable position.
Verify any site restrictions such as mastectomy, AV fistula, etc.
Is it okay that I use your right arm? You don't have an AV fistula dialysis catheter? You haven't had a mastectomy on the right side? Great.
Visually select a vein and use tourniquet if necessary. Use vein visualizing technology if available.
I'm going to apply this tourniquet. Good, I see a vein that we'd like to use.
If Sarah was unable to find a suitable vein, she could try some different strategies, such as placing the extremity in a dependent position. She could apply warmth to the extremity for several minutes with a warm compress. Also palpate the vein with the index finger by pressing downward and noting the resilience and bounciness of the vein. If using a tourniquet to identify vein, remove tourniquet temporarily, place the Chuck's pad under the insertion site, and then prepare all equipment, maintaining sterility while preparing supplies.
I have a Chuck's pad in place.
Sarah will now prime the extension tubing or INT with normal saline flush, maintaining sterility. Leave the normal saline attached to the tubing.
I'm also going to loosen the cap on the end so it's easy to take off when I need.
She will now perform hand hygiene and apply clean gloves. And then prepare the site with alcohol or other cleaning agent for facility protocol. Do not touch insertion site after cleaning. Reapply the tourniquet 4 to 6 inches above the attended insertion site. Allow the site to dry. Stabilize insertion site by applying traction distal to the site. Warn patient of a quick stick.
You're going to feel a quick poke.
Insert the IV catheter with a level of 10 to 30 degrees angle and look for flashback of blood in the flashback chamber of the catheter. Lower the needle angle and advance the catheter 1/8 to 1/4 inch into the vein. Advance the catheter off of the needle. Thread the cannula into the vein until the hub rests at the venipuncture site. Do not attempt to reinsert the stylet. Retract the stylus into the proactive sheath until it clicks. Release the tourniquet. Place the 2x2 gauze under the hub of the catheter while keeping the catheter stable. Remove the cap from the extension set or INT. Disconnect the sheath from the catheter. Attach the extension tubing or INT set while maintaining sterility of connection. Do not let go of the catheter. Flush the catheter with 0.9% sodium chloride flush from attached syringe. Watch for infiltration. Remove the 2x2 gauze dressing and clean around the site without contamination. Apply tape to the extension set or INT to stabilize the catheter. You can now let go of the catheter. Apply transparent dressing over the insertion site, maintaining sterility of the site. Be sure to cover the hub of the IV catheter, but not the extension set. Label the IV dressing in accordance to agency policy. Include the date, time, gauge, and length of needle in your initials. If not administering IV solution, apply a swab cap. Dispose of the needle in the sharps container. Discard used supplies and equipment. Remove gloves and perform hand hygiene. Reposition the patient for comfort, placing call light within reach and leaving the patient safe.
You have your call light. I'm going to put the bed back down.
Sarah will document the procedure performed, site of insertion, number of attempts, catheter size, type of dressing applied, the patient tolerance, and any complications. Also, she will document on the NUR the flush administration and scan her badge. Okay, if we were administering the IV solution, at this time, we would connect the prepared IV solution and tubing to the extension set. Use an alcohol swab or antiseptic wipe per patient. Agency policy.
a swab cap was not in place, I would use an alcohol swab and cleanse the port for 15 seconds.
Okay. Set the correct rate and volume to be infused on the infusion pump. Verify with the NUR.
Select channel, guardrail IV fluid, 0.9 normal saline. Was this correct? Yes. Rate, 100 mLs per hour. Volume to be infused, I'm going to enter 950 mLs. I'm going to start the pump, verify the clamps are open. Watch for a green light. To troubleshoot, I'm going to check my IV catheter, my connections, my slide clamp, my roller clamp, and lastly make sure the tubing was inserted correctly. If everything looks okay and the pump continues to not infuse appropriately, I might change pumps.
Label the primary IV tubing. Instruct the patient on how to move or turn without dislodging IV catheter.
So IV, as I've already told you, now that you have the IV catheter in and the IV tubing connected with the IV infusing, you'll just want to be careful when you move your right arm to make sure that you don't snag the tubing or snag the IV. If you need to get up out of bed, make sure that you call for assistance.
And we would reposition the patient for comfort, call light within reach, leaving patients safe. Again, Sarah would document the procedure performed, site of insertion, number of attempts, the catheter size, the dressing applied, patient tolerance, any complications, and also document on the NUR her flush and the primary IV. Okay, this is the end of the insertion. Then we can move to discontinuation of the IV. So patient is ready to be discharged. Sarah will come in and verify the healthcare provider's orders for the removal of the catheter.
I have an order to remove your IV catheter today.
Gather necessary supplies, 2x2 gauze, tape, and clean gloves. Introduce herself to the patient.
Hi Ivy, I'm Sarah. I'm your student nurse again today.
Perform hand hygiene and provide privacy.
I'm going to pull your curtain for privacy.
Identify the patient using 2 patient identifiers, patient name, date of birth, medical record number, and compare to the patient's NUR. Scan patient.
Can you tell me your name and date of birth? Thank you.
Verify patient allergies.
And do you have any allergies? Okay, that won't affect our procedure today.
Okay. Explain the procedure to the patient.
Ivy, I have some good news. You're going to be discharged home today, so I have an order to remove your IV catheter. I'm just going to put some gauze on your arm and remove the tape and take the IV catheter out of your arm.
Prepare all supplies and equipment using aseptic technique. Apply clean gloves. And raise the bed to a comfortable working height.
Just going to put your bed up.
Remove IV site tape and dressing, securing the IV catheter with one hand. Advise the patient you will be removing the catheter.
I'm going to be removing your catheter now.
Put a 2x2 gauze over insertion site without applying pressure. Remove the IV catheter. Inspect it for intactness. Apply pressure to the site with a 2x2 gauze for a minimum of 2 to 3 minutes. Then apply a sterile 2x2 gauze dressing with tape.
2 to 3 minutes has passed. You can take this off in about an hour.
Reposition the patient for comfort. Place call light within reach. Leave patient safe.
You have your call light.
Document the procedure performed, the intactness of the catheter, appearance of IV site, and patient tolerance of procedure. Sarah has maintained professional demeanor and language and safety throughout the procedure. The procedure is complete. Reapply the tourniquet 4 to 6 inches above the intended insertion site. Prepare the site with alcohol or other cleaning agent per facility protocol. Do not touch insertion site after cleaning. Allow the site to dry. Stabilize the insertion site by applying traction distal to the site. Warn patient of a quick stick.
We're going to feel a quick poke.
Insert the IV catheter with a level of 10 to 30 degree angle. Look for flashback of blood in the flashback chamber of the catheter. Lower the needle angle and advance the catheter 1/8 to 1/4 inch into the vein. Advance the catheter off the needle. Thread the cannula into the vein until the hub rests at the venipuncture site. Do not attempt to reinsert the stylet. Retract the stylus into the proactive sheath until it clicks. Release the tourniquet. Place the 2x2 gauze under the hub of the catheter while keeping the catheter stable. Remove the cap from the extension set, INT, disconnect the sheath from the catheter, and attach the extension tubing or INT set while maintaining sterility of connection. Do not let go of the catheter. Flush the catheter with 0.9% sodium chloride flush from attached syringe. Watch for infiltration. Remove the 2x2 gauze dressing and clean around the site without contamination. Apply tape to the extension set, or INT, to stabilize the catheter. You may now let go of the catheter. Apply a transparent dressing over the insertion site, maintaining sterility of site. Be sure to cover the hub of the IV catheter, but not the extension set. Sarah will label the IV dressing in accordance to agency policy, including the date, time, gauge, and length of needle, and her initials. At this time, she would apply a swab cap if not administering IV solution, but we're going to show you using the IV solution. Dispose of needle in the sharp container.